Julia touched on dissociation, so I have a brief review of that. I think it's really important to be aware of. It's pretty rare that we would see this in a clinical setting, but it can happen to survivors of sexual assault. And just to review really quickly, it involves a range of phenomena, including that sort of out-of-body feeling, flashbacks, overwhelming emotions, intrusive thoughts, body memories, which are psychosomatic symptoms that are triggered by the memory. And the clinician may not necessarily know that this is happening. It might not be apparent, or the patient may not be communicating this because they're not exactly they're with you at the time, in their mind, but you may get a sense that something's going on here. What to do if dissociation occurs? You want to use grounding techniques, so speak in a calm, matter-of-fact voice, avoid sudden movements, reassure the patient that everything is okay, remind her where she is and what you're doing. Stop the procedure if it's possible. Offer her a drink of water or a drape or blanket for coverage or warmth, a cool cloth for her forehead or the back of her neck. Move to someplace else if you can. Again, like I said, it's really rare, and one of my colleagues at the YW had this happen when she was doing a forensic exam on a patient, and she's been doing them for 20 years about, so but she was lucky that the advocate she had for that case was an experienced therapist, and so they were able to talk the patient through really well. Wouldn't be a nurse if I didn't talk about a care plan here for your patients. Obviously, for a non-pregnant patient, you want to assess pregnancy risk and do a pregnancy test if indicated. And if they're not pregnant, you want to talk about, okay, what are they going to do for contraception if they're not planning a pregnancy. I'm glad that Rachel touched on emergency contraception, which is contraception available that they can take after the fact within 5 days. You want to assess for risk for sexually transmitted infections and do testing if indicated. The CDC recommends that all patients under 24 get screened. And other risk includes if they've had a new sexual partner, or their partner is at risk, or they're not sure what their partner is doing. Keep in mind the incubation periods and window periods, because they may need to come back for rescreening. Make referrals as appropriate for counseling and other medical needs, substance abuse, shelter. And again, I'm excited about the medical home model, like trying to get away from the silos of healthcare. We're really kind of behind the times in terms of that model. Canada is a little bit ahead of us. They've been kind of working on that sort of model for a while, but that's the way that things are going, so that patients can have a one-stop shopping and get all their needs taken care of in one setting, including mental health needs and etc. Safety plan, if that's indicated, if she's in immediate danger, or what to do if things do become dangerous for her. And it's important to foster a supportive environment from the top down. And when I say from the top down, I mean like from the board to the administration to the clinicians to the support staff. And it's easy to say supportive, but what does that really mean? What does that really look like? And that means to have policies in place to handle situations. It's going to be, when you're caring for women, especially you know, the high-risk populations. You're going to have patients, it's going to be unpredictable, and you're going to have patients that are going to take extra time. So you want to have appropriate scheduling. You know, if your boss is telling you you need to see 4 patients an hour, you know, that might not really be realistic, and it's, you know, it's hard to, you know, negotiate that, but those kind of things need to be addressed internally. It's important to, you know, have good teamwork and be able to say to a colleague, hey, I have a patient that's going to take me extra time. Can you pick up my slack? And have policies in place, because, you know, you may have other patients waiting, and how are you going to handle that? You know, studies show that you know, patients can tolerate longer waiting times if they know what's going on, if they're informed of what's going on, and they're given the opportunity to reschedule if they need to, and if they get the appropriate time that they need with the clinician that they're waiting to see. You all realize we're in a service industry, right? That, you know, our patients and our clients are our customers, and I think it's really important that we need to focus on customer service, even in our high-risk populations where, you know, people might be a little bit more demanding, but I think it's really important to recognize that. It's important to have appropriate infrastructure. So, like I said, an environment that's welcoming, a waiting room that is not falling apart and looks, you know, welcoming and comforting. Appropriate staffing ratios and workflows, and again, just to help improve a patient's experience. It's important that your team members know what their roles are. It might not be a clinician or a social worker that gets the first disclosure of some kind of abuse or trauma. So they need to know what to do with that information and give it to the right person. Again, in terms of a supportive environment, have a policy in place to allow for a support person if that's what a patient wants. I've subbed places before where, like, the clinician that's usually there will never allow a support person in, and that really shouldn't be a rule across the board. You want to respect the patient's wishes if they do have, you know, a support person. Of course, again, it's imperative that you spend the majority of the time one-on-one with the patient before the support person comes back. You need to have policies in place for follow-up care in terms of making appropriate referrals and knowing what resources are out there for your patients, especially ones that are uninsured or underinsured. And also follow-up care includes making sure that you get enough time to follow up with the patient. Like if you've referred them for mental health services and you tell them that you're concerned about their health, you want to make sure that you do follow up with them and see how they're doing.